Is there a room for X-rays that we can go through and talk about it before there?
Sure, you can come right this way. This is one of our standard rooms. We just do regular X-rays in here. What we do is I just sign on to the machine here and take pictures of that.
Oh, so these are for the pictures that you got from
That's okay. Let's see, this is our control panel, and we set it up for taking chest X-rays, abdomen X-rays, almost any kind of X-ray. And right in here is the actual room itself. Let's get you some more light. This is our X-ray table, where we put the patients for leg X-rays, stomach X-rays, arm X-rays. This is an electronic plate. When we take the X-ray, the image is put on this plate, and then it's transmitted over to the computer and reassembled into a visible image that we can see. There are some X-rays that they prefer to do upright, standing. This is a chest X-ray board that we usually bring a patient
So
in.
if you want to say that a chest, you cannot
I could do it there, but a chest X-ray is better done standing up because the fluid goes one way, air goes another way, and it tells our doctors a whole lot about the patient just from the fact of where the fluid in the air levels out in the chest. Usually we use this when they want an upright X-ray, and there are many instances where we would need that, especially like in the stomach. I do X-rays called acute series, where we do one X-ray laying down, one X-ray standing up, and the doctors compare the two and see what.
What about, is it like harmful radiation that can fix in the patient?
No, I mean, all radiation is harmful to an extent, but us that we work in the industry, we wear a dosimeter badges because we get X-rayed every day, unless we can step outside the room. It's just a film badge, and it gets the amount of radiation that I'm exposed to on a daily basis.
That will not affect you and will not be like harmful or dangerous radiations.
No. There's always a remote possibility, but 99% of the time the answer would be no. And plus you have to weigh the benefits of the X-ray versus what do you do if you don't get it. You might not get the chest X-ray, and it turns out you might have something. The radiology department, we pride ourselves on trying to benefit people, and so we minimize the harm as much as possible. We have lead shielding. This machine has lead in it. These walls have lead in it. The door, this little sheet right here has a lead strip going all the way up and down the door. That's what this little gray thing is right here. Right. We have federal standards that you have to adhere to. And that,
So the advantages of the X-ray is more than the disadvantages.
Much more. I myself have been a patient, so I've had more X-rays than your average person.
Right.
I see. What I do is, if I got a patient here and I'm going to take an X-ray, I get the patient ready.
Can you be here?
No.
I can be in here, but somebody's going to have to push the button for me. That's one of the safeguards. You can't be in the room and doing the X-ray at the same time. So what I do is I would position the patient, get them ready, step out, close the door, and then take the X-ray.
That's right.
So if the door's not closed, the X-ray is not even going to initiate. Nothing will happen.
It has to be like in a closed area?
It has to be completely closed. This door has to be closed, that door has to be closed before I can make an exposure. And that's to protect anybody that may be standing outside the doorway. And to protect the operator of the console.
Okay, so expecting, how many times, how many like limited times can patient get X-ray during his life? Like probably if he's like living around like let's say 60 years. So how many limited time?
The minimum or
the
maximum.
maximum time he has.
That would be a question I couldn't answer.
Probably.
Let's just say you had you
Through
went to
your
the doctor
experience,
once a
right?
year, and he took a chest X-ray once a year.
That's one of.
Yeah, you could have 60 X-rays in your lifetime, and to my knowledge, the chest X-ray would not affect you inadvertently. It wouldn't cause you to get cancer. I mean, there's a remote possibility, but it would be highly unusual if that happened.
I have a question about women when they become like pregnant.
That's a good question.
Yeah.
What we do with pregnant women, let's say we're X-raying their chest. We take a lead shield. I don't have one in the room, but here's something.
Okay.
Let's say if we were going to X-ray a woman's chest, we would take a bigger shield, but something along this line, and cover up the abdomen. Now, if she was having
cause to make a problem for the baby or
no, it wouldn't be close enough. Usually, you're worried about interaction with the fetus in the first 3 months of pregnancy. Although we're careful all throughout all 9 months, but the first 3 are the most critical. But if we have to do an X-ray of the woman's stomach, and we know she's pregnant, what we have to do is get the doctor, our radiologist, to come in and talk to the patient about the procedure, and then she would sign a consent form to have the X-ray. But if I was X-raying her arm or her leg or her chest, we would just cover the fetus with a lead apron, and she wouldn't have to sign a consent form for that. As long as we, let her know that there is a possibility of a risk.
So what about the patient when they come, like if he wearing or she wearing like steel things or necklace, or I have to take off everything like lead or something, so.
Well, we remove anything that's going to be in the X-ray field. Let's say if I was going to do a chest X-ray on you, I wouldn't have to remove your watch because your arms are going to be out to the side. Now, if you had a chain around your neck, like I do, this stuff would have to be taken off.
Why?
Metal does not. The same reason we have the lid in the doors. X-ray doesn't penetrate metal.
Okay,
so if you had, say, a big necklace, and there happened to be a tumor underneath,
go through the.
No, it won't go through it. All she would see was be a big white area, and everything around the chest you would see, but not in that one area.
Good.
So one more question. So you said that people don't have to be afraid of X-rays if they have to expose to these X-rays, if they have like a fraction or if they have
no.
So they don't have to afraid and worry about it.
No, there's nothing to be afraid of, but just be careful. I mean, like I said, if you're sick and you need X-rays, don't not get them because you're afraid. X-rays are as safe as we can make them. So I can't.
We got some information about radiation, and I think this is our way to get outside of the hospital. Do you think?
Yeah. So here exists.
Okay. So I think Muhammad, we got some information from the person who working with the X-ray room, and what do you think? So I think that would be more helpful for our project.
Yeah.
Of course, we can't X-ray each other for fun, right? So when we teach students, we use these bone trapped in like lucite paddle.
Yeah.
Here, you can hold it. It's real bone.
Oh.
So whose it is, I don't know. But there's real bone in there. And, you know, we go like they would in the hospital. And, you know, put whatever body part we're using. And the students would practice.
Yeah.
And then we would get an image that came out. We have this big guy here.
Yeah. Let me help us with this.
It keeps me fit.
Okay.
Yeah. So, and it's fake tissue, so it's meant to look like the real body. So when we X-ray this, it looks like the lungs would look and how the bones would look in a real X-ray. And then our students, we have them practice on each other, not taking X-rays, but positioning.
Yeah,
So I might say, okay, we're going to have you do this, and this, and this, and pretend. Here. So here, we would do, all right, this, and turn, or do whatever position.
Yeah.
We have you lay down,
Yeah.
and
Like this machine, it can take like for full body, like
Yeah.
all the body.
yeah, it could do everything. Well, not at one time. We would have to take one picture, one picture.
Okay.
Whereas in the hospital, they have a CT scan, a
Yeah.
CAT scan,
Mhm.
and that would take one whole picture. It's a lot more radiation dose.
Yeah.
So the X-ray will take one picture, one picture.
Is this
Look
one?
at. So that's an X-ray that we
and
did.
this is X-ray.
Yeah, X-ray of the knee.
Mm-hmm.
So this would be using the fake knee in the other room. That we use. The students will put the fake X-ray knee or the phantom there,
Yeah.
and then they X-ray, and then they go, okay, well we can tell, you know, the kneecap is over top. That's a good position. We don't want it over to the side or anything like that. What else do we have here?
Oh.
Pelvis.
Yeah.
Pelvis. So that was right beside the chest. There was a pelvis up there, and you know, there's different ways that we angle the X-ray machine so we could see the sacrum more or the coccyx. See, the coccyx sits right on top of the pubic bone when you look at an X-ray. But if you were looking at the tailbone, you would angle to kind of see down into that little tailbone.
Oh. Okay.
So different things like that. Okay.
Yeah.
All right. We can go. So
Radiation area.
this is nuclear medicine. And I thought you
Nuclear
guys would
medicine.
like this, just because it's a different looking machine, and it's not on, it's actually broken,
Yeah.
but it'll give you an idea because a CT scan would be similar in size.
Oh.
It
Okay.
doesn't have the squares in the middle, it's actually like a big donut.
Yeah.
You
I saw.
probably seen a picture of it.
Yeah.
But in nuclear medicine, they do similar things in that they take a picture, come on,
Mhm.
yeah. They take a picture from the side,
Yeah.
and then this will rotate, and from the top, and they might do 45 degrees, and they do different planes. And nuclear medicine, the technologist injects radiopharmaceutical. So a radioactive substance that is paired with a type of medicine that goes to a specific body part. So let's say the thyroid. You're going to look at the thyroid gland, and we're going to give you some iodine and whatever medicine that goes with that, and it's going to emit some gamma photons. That this is a gamma camera, so this is going to pick up all the gamma photons. So it's interesting that it goes around. So CT uses X-ray,
Yeah.
and this uses gamma.
Oh, gamma.
So a little bit different, right?
Yeah.
So you have different
It's
ways.
dangerous or the CT dangerous?
Well, CT is probably the most dangerous,
Oh.
just because it's still X-ray,
Yeah.
so it's still ionizing, but you get a whole body part.
Mm-hmm.
So instead of just doing one picture, you get a cube of information.
Like around the student of Visio, they're training here
Yes.
in this building, right?
Correct.
Oh, okay. Not in MCV first.
Well, they come here first.
Ah.
We do the didactic school class,
Mm-hmm.
and then they go over to MCV and some other hospitals in the area to do clinic.
Oh,
So they
Okay.
do book here and then real life there.
Oh.
okay,
So
okay,
you may
yeah.
have,
Okay, thank you.
so when you guys went over there, you come over here, learn about the procedure from a textbook, from a professor, and then go over there and you actually interact with real patients and get to learn the exams from that side.
Mhm.
Yeah. Okay. Yeah.
Thank you very much.
Thank you.
You're
so
very
much.
welcome. Does that give you enough information?
Yes,
this
enough.
is, like very enough. Thank you so much.
Oh, very
Thank you.
Appreciate-
Appreciate it. Anytime.
Appreciate it. Thank you.
Thank you.
Thank you.
Thank
And
you.
I'm sorry for